everybody, welcome to another episode of Kristen Tries to Study, but this time with a friend, Nika. Today we're gonna have a little game, question and answer type of game about obsessive compulsive disorder and other related disorders. We have a bucket here of questions, not sponsored by Justice League, not sponsored. And our prize is gonna be macarons
By a not sponsored.
by Blue Ribbon.
Yes.
Okay. Oh wait.
Repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rules that must be applied.
Compulsion. Mahirap na.
Makakapagpapasa to sa amin sa word exam.
This disorder is the persistent difficulty discarding or parting with possessions regardless of its actual value.
Wording disorder. Very nice.
Very next.
So, 1-1.
1-1. Which gender is more likely to have symptoms in the forbidden thoughts and severe intentions? Male!
Are obsessions and compulsions time-consuming?
Yes, definitely we are. Well, for example, an individual with OCD tends to wash his hands more than 1 hour a day or 30 times a day. What is trichotillomania? How do you read this?
Try to hair pulling disorder. Trichotillomania. Ano, like discussion lang. What do you think is the difference between OCD and psychotic disorder?
The OCD focuses on the recurrent thoughts and the actions the individual is committing to reduce the obsessions. While in psychotic disorder, it focuses more on psychotic features such as delusions, hallucinations, negative symptoms, yan.
Yung OCD, more on obsessions and compulsions. Kasi yung psychotic disorders, more on delusions and hallucinations.
Get point 5.
Yes, okay, fine. Get a point.
Preoccupation with one or more perceived defects or flaws in physical appearance that are not observable or appear slight to others.
Body dysmorphic disorder.
Bakit nagsama niya mga
Pili
essay?
tayo.
Mga essay. Kaya identification.
Are obsessions pleasurable?
No, but the individuals with obsessive compulsive experience relief when they commit the compulsion. 2 points yan kasi essay. 0.5 ako, diba? Hindi 1 point. 3 ako, lang ka.
Bibilangin ko na lang pag in-edit ko. Essay ba yan?
Hindi, analogy.
Wow.
Give an example of thoughts or urges or images as obsession.
Ano? The urge to stab someone. Saka
An example of
parang pagmamahal. Pag-isa.
Ay, ikaw na.
Okay. True or false? Symptoms of OCD may interfere with its own treatment.
Yes. True. Pwede isipin nila na may na-contaminated yung
Yung pills.
What is excoriation?
Skin picking disorder. Essay na naman.
Dapat 2 points yung essay.
What do you think is the difference between OCD and major depressive disorder?
Next question.
Sa OCD, yung thoughts na intrusive and distressing. Pero sa major depressive disorder, yun ang usually mood congruent. Thoughts linked to compulsions. Pero yung sa major depressive disorder, not linked to compulsions.
What do you think is the difference, open and close parentheses, differential diagnosis between OCD and anxiety disorder?
Sa OCD, kapag may OCD ka, you can avoid yung triggering factors of being in public. You don't want to be in a mall, kunyari, kasi natatakot ka na have to wash your hands constantly kasi dirty yung environment. Sa anxiety, siguro mas more on the social aspect. Okay. Let's check the notes Okay, so yung kakaiba talaga ng OCD tsaka anxiety disorder. Yung OCD, yung recurrent thoughts do not involve real life concerns sa OCD. Pero sa anxiety disorders, the thoughts are usually about real life concerns. Okay, so give one of the 4 common symptom dimensions of OCD.
One of the 4
Common symptom dimensions.
Obsessions. Criterion A. Criterion A, obsessions. Time consuming.
No.
Sige na, sige.
Silent na. Bigyan lang natin yung 4. Cleaning, symmetry, forbidden or taboo thoughts, and harm.
Give an example of mental activities in body dysmorphic disorder.
Comparing one's appearance to other people. And give an example of mental acts as compulsion.
Washing clothes.
No,
Mental
that's,
activities.
yeah. Behavior yun.
Wait lang, alam ko na.
Para sa macarons.
Para sa mga
Counting or repeating with silent. Good. Nasa DSM-5.
What do you think is the difference between OCD and eating disorders?
Sa OCD, not necessarily limited tungkol sa food or sa weight yung obsessions nila. Eating disorders, parang doon ako. So, parang doon yung world. Pero yung OCD, pwede pang magkaroon ng ibang factors. What do you think is the difference between OCD and tics and stereotypical movements?
Ang OCD is much more complex than tics and stereotypical movements. OCD is focused on reducing anxiety and distress, while the tic movements and the stereotypical disorders are non-goal oriented.
Not goal or Oh, that's nice.
Yay!
Correct.
Ooh. Which gender is more likely to have symptoms in the cleaning dimension?
Female.
Oh my god!
Give an example of repetitive behaviors as compulsion.
Washing clothes.
Yeah. Yeah, but unless when I edit this, tas meron palang panalo talaga.
Dun, 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 dun.
How many pieces?
It turned out maghahatian namin tatlo.
Actually, the goal of this vlog is para mapilitan kami magbasa this sem break.
Kailangan namin ng drive.
Yes, tsaka alam mo, board exam. So we need to like review. We're doing a video on Nita's channel about schizophrenia and other related disorders. So watch out for that. Bye!